Hi, I'm Dr. Lianne Catton. I'm the Medical Officer of Health for the Porcupine Health Unit. I just wanted to take the time to check in and provide another update with respect to COVID-19 across our Porcupine Health Unit communities. I'd like to start by introducing our new epidemiological report on COVID-19, which we released yesterday. This can be found on the main COVID-19 page of our website, and it will be updated every Monday. We know a lot of people in our communities have been using announcements from the Porcupine Health Unit in an effort to get a better picture of what's going on with COVID-19 across our region. This report will include demographic information, some more information around timelines and testing data, and for instance, summary information that could be helpful, such as the majority of cases that we've seen thus far are over the age of 60. It will complement the daily updates we do on Facebook, in media briefings, and on our website. I do, however, have to provide a couple words of caution with respect to epidemiological data for our area. In order to get a snapshot of the data, we have to freeze it. So most of our data in this report will be behind what we're actually reporting on a daily basis. It really needs to be thought of more as a weekly review, up to the Friday previous to the Monday that we're reporting. As well, we always need to keep in mind the potential limitations associated with any data and any monitoring reports that we'll be providing. We do have smaller population numbers, and still, although we don't want to see any cases of COVID-19, a relatively small number of cases, which means that at any point in time, small changes in numbers or presentations can seem much bigger on a report of rates and percentages. So we need to keep in mind what the potential limits might be when we're reporting data and how we plan to use it going forward. We will try to continue to provide context with respect to the epidemiological reports that we update everyone on a weekly basis. As we have seen across the province, there is a greater call to ensure that appropriate supports are in place for all staff and residents of long-term care homes and retirement homes. This has been an important area of focus for the Porcupine Health Unit since the beginning of COVID-19, and locally we continue to reach out and we continue to engage with all of our long-term care homes and retirement homes across the district to ensure appropriate supports and measures are in place and to continue working with multidisciplinary teams and strong community partnerships to further expand the support to protect all residents and staff members in this sector. At the Porcupine Health Unit, we continue working closely with them and all other partners with respect to infection control measures, testing, screening, ongoing assessment, and meeting any new requirements and guidelines that are laid out by the Chief Medical Officer of Health and the Ministry of Health. I'm sure most of us, probably almost all of us, cannot remember a time in our lives where things have been so consistently disrupted for such a long period of time. It's stressful. It can be emotional, it can even be fearful. Not being able to be in direct contact with people we usually share our lives with and people we usually gain support from is really, really difficult. The steps we are all taking to prevent COVID-19 are working. We see this in our case and contact follow-up locally. We see this across the province that we are making a difference. We all need to remain committed to these measures. We need to continue to stay home as much as possible, only going out for essentials, ensuring physical distancing of 2 meters from others when outside of your household. Wash your hands diligently and often. Wash down commonly touched surfaces, try not to touch your face, and cough into a sleeve or a tissue and discard it immediately. While we do recommend enjoying this nice weather that we hope to have and see more of, we again remind individuals and community members to please enjoy it with your household members only and maintain physical distancing from those that you do not live with. This is absolutely critical. We do not want to undo the progress we made because we're tired or frustrated or lonely, all of which are understandable at this point in time. We are just simply not at a point where we can stop. We need to continue these important public health measures to reduce the spread and prevent further tragedies. The Chief Medical Officer of Health of Ontario, Dr. David Williams, asked the citizens of Ontario to be responsible in regards to cottage, or here, as we affectionately call it, camp, travel. If you don't need to go, then we'd prefer you didn't go. I'd have to echo those sentiments at this point in time, as difficult as it is for many to hear. We simply do not want to increase the likelihood of spread to any other communities at this point in time. We may see these recommendations change over the course of time, and we will continue to provide guidance going forward. However, at this point in time, we really recommend individuals and families to stay home as much as possible. Enjoy the vast outdoors that we have available outside your doorstep. We also need to keep in mind that there are many individuals who were struggling long before COVID-19, and think about how much more difficult their lives may have become during this time. Unfortunately, I also have to share that we've been sharing an alert notice around suspected opioid-related overdoses, and we need to reinforce the measures of harm reduction messages. We need to increase communication with loved ones, families, friends, neighbors who may be at risk of using substances or who we may know that use substances, to ensure that they're aware of this heightened level of risk and aware of the steps they can take to hopefully save their own lives or someone else's. We continue to work with all community partners to share these messages, to encourage reaching out for supports when necessary, and to ensure that access to naloxone, the life-saving medication to reverse an opioid overdose, is available across the district. Whether it's related to COVID-19 or to opioid overdoses or another public health emergency, we need to continue to work together. We are stronger together. We are committed. We have strong partnerships within all of our communities. We need to continue to support each other, to stay kind, stay home, and stay well. Thank you. Merci. Miigwech.